So they asked me to write an article.
Yeah.
And it was on men's junk.
Yeah.
And I thought, that's really so insulting.
Dr. Pearlman, if I can't trust my doctor, who can I trust? And that hit me.
I made it my goal to try to become a stand-up comedian and get out of this medical school thing. And it was funny, I would sit in the bar with the other comedians and they'd be like, what are you doing here? You're at Cornell Medical School. You've got it made. And I'm like, no, you're so lucky. You only have to deliver water. You have so much time to write material. You're so, I wish I was you. Years later, a show came on television on CBS called The Doctors. So I go on and I kill it. And that show ended up getting the Emmy that year. So I wrote The Penis Book. That's what it's called, The Penis Book. And people were asking me, are you going to write another book? And I would say as a joke, no, I'm going to write a musical called The Book of Penis. So there's a documentary called The Game Changers. It is about elite athletes who are vegan. James Cameron was wondering, is there like a single meal effect that we can show for sexual function? And I said, no, there's not. And so they all ate a meat burrito in my office, and then they went off to sleep. And then they came back the next day and they ate a veggie burrito. I get the printouts emailed to me, and I'm looking at them and I'm like, oh my God, there's a big difference.
Welcome to Fertility and Other F Words, the webcast that tackles fertility, sexual health, and everything in between. No topic too taboo and no question off limits. I'm Dr. Amy Pearlman, board-certified urologist with expertise in sexual, hormonal, and genitourinary health, and co-founder of Prime Institute in Miami, Florida.
And I'm Dr. Larry Lipshultz, a board-certified urologist, professor of urology at Baylor College of Medicine, and director of the Division of Male Reproductive Medicine and Surgery.
So Larry, how was your week this week?
Well, it was busy.
Yeah.
It was very busy.
So any interesting cases?
I do have an interesting case I wanted to share with you. So this is a 37-year-old gentleman, comes in with primary infertility, 32-year-old wife. We start evaluating. Of course, we start with a semen analysis. He demonstrates 12 non-motile sperm in a concentrated sample where we actually spin it down and look at all the cells in the ejaculate. So just 12 non-motile. What we're doing now that's interesting is the director of our lab, Tom Garcia, also has an NIH grant to do whole genome sequencing. So I can offer all these infertility patients for free, which would normally be a $10,000 test, entire genome sequencing. So this man was a great candidate for that because he had only non-motile sperm. So I brought the report and I wanted to show you, but he ends up having a defect in his androgen receptor. So he has partial androgen insensitivity. And this is the type of report I give.
Yeah.
So it's fascinating because we would not have known that this was part of his problem. Now, does it help us treat him? Maybe. But more importantly, it gives us a reason and takes him out of the classification of idiopathic or unknown reasons for his infertility.
So many of the disease processes that we treat, we say they're idiopathic, which means we don't know why this person is having it, right? So I guess my question is, was this guy coming in with any other symptoms of having this partial androgen receptor insensitivity?
Well, he did have decreased libido, but that's so common in our infertile men. But other than that, not really. But I think what ends up being interesting is, so what the report I get from Dr. Garcia is genes that are potentially related to infertility and other actionable genes. That means things that are defining some problem that he has that potentially could alert him to earlier treatment. For instance, colon cancer, propensity for colon cancer. He did not have any other actionable genes, but it ends up being a problem because some patients don't want to know, and others don't want it to show up on their insurance.
Yeah. So everyone has to sign a consent, right? Before doing any of this testing, understanding some of these ethical considerations.
Right. And what they sign says, I want to know only things related to infertility. I want to know both infertility and actionable genes. And I don't want to know anything. That's the third choice.
Yeah.
So most people, of course, want to know everything. But some of them, I think, and understandably, don't want to know what's going to perhaps be down the line. And more importantly, they're afraid if they know, the insurance company will know.
So what are you going to do for this guy?
We're going to most likely do a procedure where we aspirate the testicle, see if he's got a decent number of sperm in the testicle, and then they're most likely going to end up in IVF with testicular sperm.
Well, that's fascinating. And you're currently enrolling patients in this NIH study, right?
Yes. So we have to enroll, I forget what his target is. It could be 450 or 750. I don't remember, but we have to, for the sake of the endpoint of the study, we have to enroll about 6 a week.
So who's a candidate for people who might be interested?
Any man who's seeking infertility evaluation and treatment.
Wow.
Yeah. So a wide range of types of testicular failure.
Well, I imagine a lot of people would be interested in testing like that.
Yes, especially when they realize how expensive it is and they can get it free. So,
Larry, how difficult is it to run an NIH-funded grant?
I mean, it's very difficult. And I got pulled into the grant after it was already submitted. So I was not involved in the really difficult part of going to committee and justifying the grant. But there are certain endpoints that they give you, certain targets that you have to meet. For instance, this one, we have to enroll X number of patients by a certain date, or, he's going to have problems with funding.
Yeah.
And I think the whole thing is you want to generate enough data so that you can get refunded.
Now, NIH funding is a hot topic these days, right? And we know it's really challenging to get funding, and funding is certainly being cut. And like from your perspective now as the PI on this study, how regulated or how, what are the eyes that are on this work that you're currently doing? It's not just like, hey, okay, now you have the funding for this study, you can go run and do what you need to do. I mean, you have frequent meetings with these committee members.
Yes, I now that I've been brought in as a co-PI, we just had a meeting this week. And the gist of this meeting was meeting targets. Are you meeting your targets? And then, of course, you have to submit regular reports on progress. And then you submit, for instance, it's a 5-year grant. So now in our 4th year, Dr. Garcia is working on a resubmission.
Yeah. Wow. It sounds like a lot of work.
Yeah, but it's really giving us that extra step, the depth that you have, because we know the semen analysis is not a fantastic test. It tells us the number of sperm. It tells us if they're moving, but it doesn't really tell us if they're healthy. This gives us another direction in terms of really investigating what's causing the problem.
Yeah.
And something maybe that will lead to better therapy.
Yeah. And, during some of our podcast episodes, we talk about how crude our current testing is. And it seems like you and your colleagues at Baylor are really on a mission to help with the evaluation because you can't treat what you cannot diagnose.
That's definitely true.
Yeah.
What you're going down the line, you're going to meet 2 of our fellows who are now junior faculty, each of whom is working on a very exciting area and going beyond the semen analysis. So I'm really excited for you to meet them.
Yeah, that's fascinating. And so much of what we talk about when it comes to infertility and IVF is IVF doesn't have a 100% success rate, and it's a very costly process and takes a lot of effort, right, on the parts of the patients. And so would this help potentially figure out, better candidates for IVF?
I think so.
Yeah.
It's going to give us a better idea of the likelihood of things working. But I think with IVF, it's not only expensive.
Yeah.
It's emotionally draining.
Yeah.
I mean, just think about those couples.
Yeah.
Because it's a build-up. Does she have eggs? Yes. Do they fertilize? Yes. Do they make it to blastocysts? Then they have to implant the blastocyst. Did she get pregnant? So each of these hurdles becomes an endpoint that if you don't meet it, you're done.
Yeah.
And I don't know how this couples do it, but they do.
Yeah. Wow. Well, thank you for sharing that very exciting information. I don't know that I have anything that exciting in my clinic files,
come on,
from the last few weeks.
I'm sure you do.
But so I saw a patient, this was about a week ago, and he's a guy, he lives in the Philadelphia area. And he had been doing his research. What I love so much about my patient population, I think the viewers of this podcast, is that people want to be really well educated so they can go into their healthcare provider's office with some baseline knowledge, right? So I have a lot of content online specifically related to penile girth enhancement. Maybe one of our episodes will be on penile girth enhancement. That's
sure.
also like a hot topic. And so this guy had been watching a lot of my content. He's a young man. And, when it comes to hyaluronic acid filler, I don't oversell anything. I mean, that product, usually my patients will come in, could be 6 months later, could be a year later for some maintenance. It is a temporary filler. I am fully transparent with that. But he found someone else in Miami who said his products would last 7 years. And that sounded really good to him,
We're not good.
Right. Yeah. And so he went to this other gentleman who put in a ton of filler at once. He
Same
developed
type of filler?
Well, the thing is, the office wouldn't necessarily tell him the type of filler. They said it was hyaluronic acid based, but they were kind of framing it as a special formulation.
Right.
Which sounds great right before you get it done. But if you have a problem, you're like, no, seriously, what did you put in my penis? Right?
And can we do something about to reduce
Exactly.
it?
Because with the hyaluronic acid fillers, the advantage is if I needed to, I could dissolve it with a medicine in the office, not requiring an operating room.
Do you ever have to dissolve it partially to get a better...
Yeah.
better
And
results.
I tell patients that, and I can do that, get someone to their girth goal first. Because if they have some areas that need to be evened out, as I put more filler in, I can even out those areas.
Yeah, that's what I was thinking.
Yeah, so oftentimes I don't even need to dissolve anything, but I can if I need to. And so he had developed a ton of swelling. He developed blistering of his skin. And now he has like a bad cosmetic result. And you know what he said to me that was very impactful? Because his biggest concern was that the person he went to was very non-transparent with everything that was going on.
Well,
that was like his
tell
biggest,
him what it was.
Exactly. That was his biggest concern. And he said, Dr. Pearlman, if I can't trust my doctor, who can I trust? And that hit me.
Right.
Because we tell people, the slogan is, trust me, I'm a doctor.
Right.
And yet so many people are losing faith and trust in their healthcare providers because of a lack of transparency. And what I'm excited about today with our episode is our guest, he is out there with education, right? So,
but a unique type of
education. A unique type of education that kind of brings in like some humor and I think some personal experiences, right? And I think that's perhaps how we can rebuild some of this trust that people have lost in the healthcare system.
Right. And you mentioned that the patients do their homework, but I don't really like the fact that sometimes they come in and they know too much about me. I like a little bit more of the mystery, at least, but they know where I was born, they know where I went, because they all look you up. I would never look up a doctor before.
I would definitely look up a doctor.
Yeah, but let me tell you my problem with that.
Yeah, okay.
People can look good on paper,
right,
and be terrible in person. So I would rather get a recommendation from somebody I know and trust that they had a good experience with Dr. X.
Yes.
Rather than reading that Dr. X went to Harvard.
Okay, but that's, I think, a great place to start, right? And it brings up this concept of who do you ask to figure out who to go to?
Right.
And oftentimes I'm asking, could be nurses, could be any type of support person in a hospital, because they interact with all the different specialists and can give you more of a perspective of maybe the personality, right, of a healthcare provider. If someone's at an academic institution, I'll ask the residents, who do they recommend? Because again, they're working with a lot of people. But I think that's a great place to start is who does someone recommend, a trusted person, and then looking up that person online. But I think that's some of the value of doing some of this, podcasting that we're doing is, isn't it great if people can learn our personalities before they show up to clinic?
Maybe they won't like my personality.
That's possible, but they should know that before they schedule a visit with you. And the reality is you're not going to know the difference.
Now, let me tell you something interesting.
Okay.
And that is some doctors that I have known, I'm thinking of one specific woman doctor, had two personalities.
Oh.
She had her professional personality with patients, and then she had her social personality. They were very different. She had a great sense of humor, but not with patients.
Okay.
Very, very,
right,
rigid with patients.
Right.
So, it helps, but now, whoever's watching, what you see is what you get. I do not have more than one person. It's too hard getting one personality. But I really do think some people have their professional, personality. Now, you don't, I can tell.
Well, I tend to stick with one personality, but on some of our episodes, I do get a little personal. And that's where I'm kind of I'm not really sure how many personal stories I should bring in, but I think that's part of my secret sauce.
Yes.
Is we have so many patients that come in, and as sexual medicine specialists, we expect our patients to just, within 5 minutes of meeting us, to verbalize things oftentimes they've never verbalized before. And I think sometimes if we can share some of our personal experiences, hey, this truly is a shared experience.
Right.
Let me figure out how I can help you, can help set the scene.
It's kind of I've been there too.
Right. But not hey, welcome to the club, I have ED too, but
well, you couldn't have ED.
Right, I couldn't have ED. But hey, yeah, I know what you're feeling. That really sucks. Let's fix it.
Yeah.
Yeah. All right, Larry, let's segue into some breaking bedside news.
Okay.
And you're actually an advisor for Men's Health.
I am. A long time now.
Yeah. You've probably contributed to many different interesting topics.
I have.
Yeah.
In fact, they had a book that came out. I don't know if I ever tell you this.
No.
And it was called What Doctors Eat. Which is right up your alley, right? So we all had to send in, whoever they asked, had to send in recipes.
Yeah.
So at the time, my housekeeper, Rosa, every morning would make me a oatmeal pancake.
Uh-huh.
Very healthy with a banana.
Oh my God. I
you have
recently made that and it is so delicious.
Did you really?
Yes.
Yeah.
Like a banana and an egg.
Yes.
Yeah.
That's so funny. Anyway.
And blueberries.
So I put it... No, I have sliced bananas.
Okay, all right.
But I put it in as Rosa's pancake.
Yeah.
So now Rosa is immortalized, and she's got a CV because it's in the... Anyway, back to Men's Health.
Yeah.
So I really think that we're going to be able to get some interesting articles to discuss out of Men's Health. And that's how I came across... So they asked me to write an article.
Yeah.
And it was on men's junk.
Yeah. And the terminology, right?
Yes, the terminology. And initially I thought, oh, that's fun. And then I started thinking about it.
Yeah.
The article came out, And I thought, that's really so insulting.
Yeah. And I've never thought about that before.
I know, but why are men's external genitalia called junk? There's no word like that for women that you can use in everyday parlance, but everybody uses junk. So why? And what, do you think it's good, bad, you don't care? What?
I've honestly never thought of that before until now.
Yeah.
But I think it's bad.
Bad, right?
So what are names that you prefer?
I don't, penis.
Okay, all right. I mean, scrotum, testicles, like the anatomic names.
It's like vagina.
Yeah.
That's what they are.
Yeah.
But what they did is they used that concept of junk as an introduction to this article. And then they went over some of the common urologic complaints that men have, but it really wasn't related to junk. It was such things as urinating problems but they did do ED. So they do get into some of the good stuff.
Yeah.
Why babies aren't happening, which is right up our alley, right? So I thought, I liked the article. I liked where they went with it. I like whenever Men's Health addresses really impressive problems, significant problems, people that they can learn from. This particular issue that I picked off the shelf this week is all about...
Is this you on the cover?
It is.
Yeah? That looks like you on the cover.
It's all about exercise. And I don't like that particularly for Men's Health because they're addressing a topic for which there's not a lot of magazines out there. So if they want to talk about men's health, let's talk about men's health.
Yeah.
But I mean, there's so many exercise magazines and supplement magazines. But this could have been just this issue. I have not been following them that closely. I am going to start following them that closely, and maybe we can pull some other things out of it.
Okay, so let me pick your brain a little bit.
Okay.
In terms of like a men's health magazine, topic, what are some of the men's health issues you would like to see front and center?
Well, I think a lot of what you and I talk about, I'd like them to be a little bit more serious about erectile dysfunction, male infertility, and certainly hormone therapy. I know they do address it because I've seen other issues when they have, but I just think it's important to look at hormones, things about aging, things about staying healthy, things about your diet. Yeah, they didn't go into any of that in this, so I hope they kind of refocus a little bit.
So if you're listening, actually what I think would be a really great topic is something that we discussed on a prior episode, which is your recent work in men who are on testosterone, who are interested in having children. And instead of having to necessarily stop their testosterone, is boosting their sperm parameters with things like HCG and FSH.
The problem that I have with that is that it was a good scientific article, but FSH and HCG right now are fairly hard to get unless you're willing to spend a lot of money.
Yeah.
And Men's Health usually tries to go to middle of the road expense. But I still think the point is a good one. That is, men should know that they don't have to stop testosterone if they want to have their kids.
Well, and men should know if they start testosterone, get a semen analysis and a hormone profile before to know what your baseline is. And maybe that's the message to most men around the country.
And that's what we looked at on our first episode.
Yeah.
Yeah. So I think I agree with you. So are we going to give it a thumbs up or a thumbs down for an article about junk in Men's Health?
Okay, I think the article has a great topic. I think the terminology is a thumbs down. So it's a thumbs up and a thumbs down.
Yeah, but you got to pick one. You can't you did that the last time.
No.
There's no such thing as middle of the road.
Okay, I'm going to say a thumbs down.
Okay, I'm going to say a thumbs up because at least they're looking at men's issues related to health.
Yeah. Okay, fair enough.
All right.
Well, I can't wait to get into today's episode. It's going to be a fun one. Welcome to today's episode. I am thrilled to introduce a remarkable guest today, Dr. Aaron Spitz.
So Dr. Aaron Spitz and I go back a long way. He was one of my fellows with me in 1999. He is a board-certified urologic surgeon and a nationally recognized expert in male sexual health and fertility. He has served as assistant clinical professor of urology at UC Irvine. In addition, he's author of The Penis Book, a doctor's complete guide to the penis from size to function and everything in between. And I have read this, and it really is a worthwhile read. He has also appeared on programming like Dr. Phil, The Real Housewives of Orange County, and even The Doctors.
In addition, Dr. Spitz played a role in the documentary The Game Changers, one of my favorite documentaries of all time, exploring how diet influences male sexual performance, and is known for pioneering work in fertility microsurgery, advanced vasectomy techniques, and broad media advocacy for men's health. He has even written a musical called Conversations with My Penis.
Aaron, it's so nice of you to come, and Amy and I are very excited to hear about what's been happening with your new directions in your, not real practice, but your hobby? What do we call it?
Well, yeah, it's kind of like a vacation vocation in a way.
Vacation.
It's a lot of fun.
We'll hear
Love
about
that.
that.
But, yeah.
But to go back, you
Yes.
and I go way back to 1998.
Yes,
When you were a fellow with me here at Baylor College of Medicine.
that's right.
Reproductive medicine and surgery.
Yep.
And you've gone on to become internationally known. Right?
Almost
before we-
famous. I'm almost famous. Yeah.
What was it like working with Larry for a year?
Yeah, it was.
And only nice things.
It was an incredible year. The first sort of blush of that year was, my God, how does he do all that? We finished the year, Dr. Robert Brannigan and I, just spinning and thinking there is no way we could ever work that hard or do that much. It was just unbelievable how prolific you are and the amount of things you were doing simultaneously.
I can't remember.
Oh, yeah. No, I mean, so the patient volume was incredible and it's legendary. Friday Clinic was legendary. And then the surgical volume was incredible, and also the surgical prowess. I mean, the expertise in microsurgery that you displayed was very daunting because
He's not being paid. to
no,
say this.
we come out at the end of that year like I'm worthless. I can't even use chopsticks, And we did. There was a Chinese restaurant in the medical complex that Bob and I would go because it was like the one place we could afford to eat out. So no, it was incredible. It was an incredible year because what you were doing in the space of just a year was so impressive. And then in retrospect, it's like, well, that was just every year for you, right? Mm-hmm. That was this big. Significant milestone year for us, and that was just another year for you.
Yeah.
The press, you're on with international news. You're reviewing journal articles. You're creating scientific advances. I mean, like everything was happening all at once.
Enough about
and it was
me.
incredible. Yeah. So it was a whirlwind year. There was so much packed into a single year, and it was an incredible way to we're drinking from a fire hose, and it was great, and it put me in a really good place because all these years later I now feel very comfortable as an expert, but it's because of that foundation I had with you, and also you continued to allow a relationship. So I know through the years as my practice was growing, you were always there. If I had a question or a concern, you could always answer that. You could always point me in the right direction or give me a hookup. I mean, it was great.
Yeah.
Yeah.
So this is the first time
We've remained friends throughout.
Yeah.
I see that. So this is the first time you and I are meeting in person.
Yes.
But I started reading the penis book a couple years ago when I was directing the men's health program at the University of Iowa. And I remember very vividly, I was on the Stairmaster at the gym reading the penis book.
Wow. That's awesome.
So why don't you talk to us about that book?
Yeah.
Wait, before we hit the penis book,
Yeah.
let's go back to you as a medical student in New York.
Okay.
And
The
your,
very
and your
origins.
history
The very
of
origins.
stand-up.
Yes.
So
yes.
let's share that because Amy doesn't
Yeah,
know about
that's
that.
good.
Okay. So, well, it actually goes a little bit before that. So I did stand-up comedy while I was a medical student. The reason I did was because when I was in college, I was on the debate team, and we did parliamentary debate, which was the art of bullshit. There was no facts and figures. It was just who could come up with the most persuasive speech, and it was fairly extemporaneous, and humor often carried the day. And I excelled at a particular subset of that competition called individual speech, in which you were given a topic, and you immediately had to give 5 minutes on it. And if you were funny, you could carry the day. And so I ended up doing very well with that. And then I was at a tournament at Columbia University, and I should have won, but this guy beat me. And I said, that really sounded like a set, like it was pre-written. It didn't sound like a spontaneous speech, And then I learned that he had been doing stand-up comedy, and it was a set. And so then I thought, well, geez, if he can do stand-up comedy, I bet I could, because I thought stand-up comedy was like something nobody could do but, Jerry Lewis or whoever, Seinfeld, whatever. So that summer, I went to work and I wrote a set. I went to the Punchline in Sandy Springs, Atlanta, where I was living, and they let 5 people do their stand-up bit out of a big jar of like 100 people who've lined up to go, and they put you before their big headliner. So it's not like open mic night. It's open mic warm-up and then the real headliners. And I was one of the 5 that got pulled. There was 400 people in the place, and they had all paid a lot of money to see big headliners. And I killed. It went great. And I got off the stage, and I had the worst stomachache I ever had in my life. I couldn't believe. I mean, I thought my appendix was bursting. It was so bad. I had suppressed that. But then I was like hooked because it was such an incredible feeling. It was like a combination of love and power. It was just because you're making people spontaneously have a physical reflex that they can't control just from what you're saying or doing. And it was such a cool feeling. So I arrived at Cornell Medical School, and at that moment in time, Tom Hanks had a movie come out where he's portraying a medical student who goes into stand-up comedy. It was called Stand Up. And it was literally showing in the fall of my first year of medical school. And I was like, the universe is speaking, right? So I made it my goal to try to become a stand-up comedian and get out of this medical school thing, you know. And I went and I took improvisational comedy classes up the street at Second City, and I would go and do open mic nights, and I would play clubs, mostly lower level bars with comedy nights, but occasionally like actual comedy clubs. And then that summer it's your only summer, the summer of first year medical school that you actually have off.
The last summer of your life.
The last summer of your life. I did a bunch of stand-up. And what's really interesting is second year was so intense, you know, the workload, the curriculum, that I couldn't keep it up. And I was never given an HBO comedy special. And it was funny, I would sit in the bar with the other comedians, and they'd be like, what are you doing here? You're at Cornell Medical School. You've got it made. And I'm like, no, you're so lucky. You only have to deliver water. You have so much time to write material. I wish I was you. And we would have these bizarre conversations like that. And I meant it. So I got invited by another comedian to be in a showcase where a big club said, pick your 5 favorite comedians and bring a showcase. And so she picked me as one of them. And I hadn't done comedy in many, many months, which was good because when you write things creatively, you kind of get, married to them. They're your babies, and you think they're all beautiful. You don't have ugly babies, and it's very hard for you to edit yourself. And the key to good writing or anything is actually being able to edit. So, with all that time and distance away from my comedy, I put together a set that was like actually my best set ever, and I did the showcase, and then it was time to take boards part 1. You remember boards part 1, like the hardest test you've ever taken in your life, where you go underground in the library for like 2 or 3 weeks straight. All right, so I took boards part 1, and I got to the end of the answer sheet, and I was on the last question, but there was 2 more bubbles.
Oh, no.
I had frame shifted somewhere in that test. I don't know where I frame shifted. I just went like, tunnel vision, unbelievable, horrible feeling. And that evening of that
So what did you do?
Shift, I got called that evening by...
But did you say anything to anybody?
No, I couldn't do anything. I was like, what do you do? I don't know what to do. I just turned it in. It's a 2-day test. It was part 1 and part 2. So then the next day I've got to go and crush it because I don't know what the hell happened. And that night that afternoon I got a call from Stand Up New York, big club on the West Side, saying we want to audition you to be an MC. And the MC position is where you launch into television. But the audition's tonight. I declined, and I took boards part 2, and I did okay. I should have done better, but whatever. And so that was the end of my comedy.
Wait, what happened to the frame shift? You would have gotten everything wrong on the first day.
Well, it doesn't matter where. I don't think I frame shifted at the first question. I frame shifted somewhere. So once you started somewhere in the body of that test, I started getting wrong answers. Yeah, I got everything right.
I thought you were going to say it just shows that it doesn't make a difference what you do.
Well,
still pass.
When I matched, my first choice was UC San Francisco, and they take 3. And I was number 4. And Peter Carroll, who became the chair, was, he wanted me there. I was his first choice. I did my audition rotation. And he called me up after match. He's like, Aaron, what happened? I thought you were going to rank us. I'm like, what happened you? And so he's like, well, let me look into it. And there was this one faculty who I never interviewed with who was at the VA, and he didn't like my board scores. So
really?
It came back to bite me. Yeah. But it worked out the best because I went to USC, which was a fantastic training, and that got me into your fellowship.
Right.
I met my wife there, and we have 3 amazing kids, boys, and so it all worked out for the best. But anyway, I put the comedy up on the shelf between boards 1, day 1 and day 2. But I always thought about it, and then I ran into a guy in a bar.
That's where all good
running
stories
into
start.
people in a bar.
So I'm a second-year resident now at USC, which is the belly of the beast. It's 2 years of general surgery. I'm doing trauma, 134-hour weeks. It's insane. Well before the hour limits, and I'm in my scrubs. It's like one of the few groups of hours I have off. I'm with my. I don't think we're quite married yet, or we may have just gotten married, wife, and we're in Santa Monica in a bar, really hip. And there's this guy, I'm looking at him, he's looking at me like, I know this guy from somewhere, And I go up to him, I'm like, I feel like I know. He's like, yeah. And I go, New York? He's like, yeah. comedy? Yeah. And we had done a show together. We had, and I was like, oh, man. And I said, so how's it going? He's like, oh, it's incredible.
He's the head writer.
I've got a TV show. I work with all these incredible people. It's so much fun. What are you doing? I'm like, wah, wah, wah. And I'm thinking, what if I had done that MC?
Right.
Yeah, but at any rate, it was this very funny moment. But it was always, kind of there under the surface. And then things just started to happen where I got opportunities to be on television. And the very first one was Vaz Clip. Remember Vaz Clip? Vaz Clip was this WEC clip that you put on the vas deferens, and we did studies on it.
But it never got...
It had a high failure rate.
Yeah.
And you did some of the histology studies, actually, that showed that it recanalized around the clip.
Right.
Yeah. Well, the Vaz Clip PR people, this guy named Scott Olson, who unfortunately passed away, they were unbelievably effective. And they identified me as the only person in California who was using the product because I used it in fellowship. And they arranged for CBS World News to come and do a story on this amazing innovation. And they put cameras in my office, and we got a patient and the whole thing. And it went global. And people were calling like, all right, so I had CBS World News. And then, of course, they take these stories and they recycle them in all the local affiliates. So there I was on TV. And I thought, man, that's kind of interesting to be on TV with my services. Maybe I can do that deliberately to exploit it. So I called the head of the PR from VasClip and asked him if I could just hire him privately just to promote my little practice. And so we did a no needle, no scalpel vasectomy segment for KTLA, for local LA news. And then that thing got repackaged and distributed nationally because they recycle each other's news. And because of those two things, years later, a show came on television on CBS called The Doctors. Mm-hmm. And it was a competitor to Dr. Oz. And the premise was it's going to be a panel of doctors, and they're going to interview other doctors and other medical people about all the latest, greatest stuff. And before the show opened, they were scouring the media universe for doctors that they could put on TV, and they found my vasectomy things. Oh, so they called me up.
They made you famous.
Yeah. So they called me up and they said, hey, and when the show was first starting, they didn't quite have their bearings. So I got called by this New Yorkie producer woman, and she's like, hey, yeah, we want you to come on and do a vasectomy on the show. I think it'd be really cool. I'm like, okay. And she goes, but here's the thing. We want on a young guy, like a 21-year-old guy who it's really controversial. And I'm like, no, I don't think so. She's like, well, that's what we want. But then I'm like, who's the host of your show? Because why aren't I? And so she lists the people, and the head host was Travis Stork, who had just won The Bachelor, but he was an ER doc. Yeah. So that was, okay, I'll give you that. And then another one of the hosts was Lisa Masterson, who had gone to USC residency, and I knew her from residency, and she was an OBGYN. And then they named some others who I didn't know, and I'm like, how about I be a host on your show? I know Lisa, I'm really good. You should interview me for being and they're like, no, we're fine. We're fine. So then that went away. And then the same producer calls me back about a month or two later, and she goes, hey, I was talking to one of our grips, and I guess he's got some kind of problem with his sexual function, and he sticks needles in it. Is that a thing? Do people do that? I'm like, yeah. She's like, yeah, can you come on and talk about that? Because she just wants something salacious, right? And I said, yes, I will come on and talk about that, but I will talk about every form of treatment for erectile dysfunction, not just that. And she's like, okay. So I go on and I kill it. And she comes up to me and she's like, you're a rock star. And it was very educational. It was fun. It was funny. And that show ended up getting the Emmy that year.
Wow.
Yeah. It was
did you get
the first
a little
season.
statuette?
I did not, but that was an outlet for me to bring comedy, but also education. And I ended up doing about 60 appearances on that show over 11 years. Yeah, and it was because of cutting my teeth on being able to communicate with humor, but with medical precision, that led me to be able to write this book. And this book was basically something I graduated into.
Because you just said this book, but I don't think you identified it.
Yeah, so I wrote the penis book. That's what it's called, the penis book. The subtitles from size to function and everything in between. And one aspect of the title I don't like, it says A Doctor's Guide to Erectile Dysfunction. And I told the publisher, that sounds like it's for doctors. And many people think it's like a textbook for doctors, but I'm the doctor, it's my guide. It's for the general public. However, Many medical professionals have used it. Many PAs have used it because there's enough medical information in there that it can actually, guide your evaluation and treatment choices. But I wrote that book because I was actually solicited to write a book. I had been recommended to write a book from that PR guy from years ago, and I was lazy. That's why I didn't go into academics. I didn't want to write. I didn't want to write papers.
Right.
Little did I know that other people write them for you. But
Not here.
no. So I was lazy about writing. And so then I'd been on the doctors all this time, and a friend of mine had met a literary agent and introduced me to him and said, "Hey, you ever thought of writing a book?" I said, "Yeah, but I wouldn't know to start." So this guy is a literary agent for doctors, and he's done many doctor books. And we had dinner at my friend's house, and he saw my activity on television, and he said, "I can get you a book deal." And I said, "Great." And I said, "Okay." And he goes, if you follow my instructions, you'll have a book by October. And this was in like March.
Wow.
And I was like, interesting. And he goes, "Okay, well, what do you want to write about?" I go, "I don't know. What should we write about?" I could write about the prostate. I could write about the testicle. I could write about the penis. Mm-hmm. And literally on a napkin, we came up with the penis book. Let's call it that. Let's do a book about the penis. And that's how it was born. Mm. And then he gave me the roadmap. I worked very hard for 7 months. And in October, he had me a book deal with Rodale Press.
Wow.
Just like he said he would. And then I took another 8 months to actually write it. And that's how the book came about. But I'm so glad I did, because the book is this great ambassador for my patients. I, like many urologists, run about an hour behind pretty much every day. And instead of patients angry in the room, they found their chapter. And they're already figuring out what's going to happen. And they like the humor. And so it's been, even if I never sold a copy, it's a great ambassador.
You give them a book?
No, I just have them in all the rooms. But I do give them chapters from the book that are relevant to their condition for free. And many of them, do buy the books, actually. But the book has gone on to be published in 6 languages.
Wow.
And so it's sold and read all around the world. It's very gratifying. And then it's opened up other doors for me, of course, too.
Where I found that book very helpful as a physician is it gives me the language to explain complex conditions in a very simplified fashion.
Yes.
And I think that's where it can be most helpful for urologists.
Well, I appreciate you saying that, because that really was the skill I honed on television. Is you have a very short amount of time to get a complex medical idea across that everyone's going to be able to understand, and also that they're not going to fall asleep listening to. And so I appreciate you recognizing that. That's great. Thank you.
So I know, we both know that you have a musical in the works.
Yes.
Soon to go to Broadway, fingers crossed.
Fingers crossed.
So did the book help in terms of the movie, of the show? Was there?
Yeah, it's very funny. The book came out in 2018 in March. It just missed Valentine's Day, if you can imagine how great it would have been if it came out for Valentine's Day. Yeah. And people were asking me, "Are you going to write another book?" And I would say, as a joke, "No, I'm going to write a musical called The Book of Penis," like the Book of Mormon.
Right.
And that was my joke. And in March, just a few weeks after the book came out, I was in Las Vegas, invited to give a lecture for LUGPA, Large Urology Group Practice Association. And it was a very unusual lecture, because I was going to be a co-lecturer on the same stage with Evan Goldfisher, who happened to be my classmate from medical school, with whom I was in practice for almost a year at the very beginning of my career. And now here we were sharing a stage, hadn't seen him in several years, catching up. And he's like, "Hey, what are you up to? What are you up to?" And I said, "Oh, I just published a book, a penis book." He goes, "I just wrote a manuscript called Conversations with My Penis, 25 Years of Urological Stories, and I'm about to try to get published." And I said, "Well, show me yours and I'll show you mine." And mine was bigger. But his was more entertaining in a way, because he had all these patient stories. And he called me up after reading my book, and I read his book, and they were very similar. The didactic parts were very similar, good sense of humor, simple explanations, the whole thing. And he had written another book previously called Even Urologists Get Kidney Stones. So he was a good writer. And he said, "Aaron, I don't think the world needs 2 penis books, but I've been thinking about turning mine into a comedy musical." And I'm like, "That's my joke." And he's like, "No, I'm serious. And I don't know how to write music. I don't play an instrument. I've written some fun limericks for a party now and then." And I thought that, and considering how much work it took to write a book, I knew this was no small deal if I was going to agree to this. And I was like, "This is crazy." And then he explained to me, he's a serial investor in Broadway. He's completely immersed in the Broadway world. He lives and breathes Broadway. He sees every show that comes out ever. And he's got a lot of connections. So I was like, okay, well, there's a landing place if we actually try to do this. So that's how it came about. It was actually pitched to me. And so our books are source material for
Because I've met him
content.
at your, he's in the Reeds. I mean, right?
Yes, that's right. And so we originally set out to hire somebody to write it, ghostwrite it, and we would inform it. Just like with my book, actually, when I first decided to write this book, I was going to have a ghostwriter because a lot of doctors do that. And I never found a ghostwriter that actually could do what I was trying to do. And the same thing happened with the musical. We found the Walton brothers. These are Broadway writers and stars. And we were introduced to them through Barry Brown, who's a Broadway producer that Evan knew, that we hired as our consultant. And we got together in a New York diner with these Broadway writers and actors, director of When Pigs Fly, and everybody was really excited. And we drew up a contract and they started to work. But then soon into it, they told us, hey, you guys need to leave us alone. Because we were wanting to inform them about the medical aspects of it, the scientific aspects of it. And they didn't want to work that way. And the whole point of this musical is that it's fun and funny, but it's actually medically very accurate and actionable. And people can see their own conditions or conditions of their loved ones, or just understand what's going on with men and men's health. And it's all precise and accurate, just like my book. And that needed to be there. So we finally realized we're actually going to have to write this ourselves. And that was very kind of scary and this like, wow, are we really going to do this? And so we set to work. And, I had some confidence because of my book being published that, hey, maybe I can write a musical. And when I was in college at Cornell, a lot of my electives were in theater arts. I took playwriting, I took acting, I took directing. So, it was way back in there on some dusty shelf. And when you do stand-up comedy, you're the writer, director, actor. So I thought, okay, well, maybe we can do this. And we were kind of stumbling along, finding our way. What is the story? What is the story arc? Is this just a song cycle of a bunch of funny songs, or is there going to be? And we were really challenged with this. And then we finally found our way.
But were you following his book at the time?
So we did take some of his patient vignettes and adopt them into songs. Yeah. So some of the songs are based on some of his vignettes, and some of them are not. Some of them are based on my ideas. And what really accelerated our process was when we finally got a composer, because neither one of us are composers, right? So we're writing the dialogue. We're writing lyrics to, whatever rhyme scheme or what have you.
Yeah.
And then I'm in the operating room one day doing a testicular sperm extraction for an IVF cycle. So that's why this is a fertility podcast topic.
Of course.
Yes. And the nurses are always asking me, like, when are you going to be on TV again, or what's going on with your book or movie, what have you? And I said, well, I'm actually working on a musical based on the book. And the anesthesiologist pops up from behind the curtain, who I've never met before. And she says, do you have a composer? I said, no, we're actually interviewing some composers from New York right now. And we had one interview earlier that week, and we had one coming up. And she goes, well, I just met a composer at my daughter's school. You want me to introduce you? I was like, great. So I looked him up. He's like a heavy hitter in Hollywood, Hollywood composer, music industry composer, orchestrator. He's worked with Whitney Houston, Stevie Wonder, all these people. And he just so happens to live like 3 miles from me in Dana Point. And so I'm thinking, this is like, he's not going to want to do this. And I had a conversation with him on the phone. He was very nice. I sent him what we had. And then he emailed me right back. He's like, I love this. I want to do this. And he was all in, sweat equity, no fees, just partner with us. And he would commit the time and energy to do this. And we were like, that's incredible. But, is he going to be any good? Right. So we sent him a set of lyrics. He sent us back an audio file. It was a simple piano line and him singing. And he can carry a tune, but he's not, a singer. And Evan and I listened to it, and we were like, I don't know. I don't know. But we don't have anybody else, and he is free. And we were kind of tired of spending our own money by that point for the consultants and the writers and this and that. So we went with it. And he did 5 songs. And by the time we had our 5 songs written, Evan had the idea, hey, let's make a studio demo and shop this around Broadway, not realizing that's not how it works. It's not
Let me
like
ask you
Hollywood.
something. When you do a musical in general, when you write music in general, do you do the lyrics first or the music first in general?
Probably in general, you do music and you hang lyrics on it, but we were doing it backwards.
I know.
Because we had already started. We'd already created a library of lyrics, So we go to a recording studio in Los Angeles, which Patrick knows all the studios and all them, and he assembles 5 musicians and 6 singers on Evan and my dime. We pay for this. And Evan and I are sitting in the recording studio, and all we've heard is Patrick's piano line and his voice. And all of a sudden we start to hear all the instruments playing the parts, and we're like, whoa, this is like really good. Oh my God. It was like this mind-blowing moment. We're looking at you like, all right. And even the soundboard people and the studio owners were saying, who's your composer? This is like really good music. And then the next day we brought the singers in, and it was just so cool. And it was really an amazing feeling to hear these lyrics that you wrote performed by a full complement of professional musicians and singers. It was wild.
So what do you tell people when it comes to nutrition? Because you were on the Game Changers documentary on Netflix, which I absolutely loved.
Oh, thank you. Thank you
so
very
when
much.
your patients ask you, based on kind of some of the work that you did with that documentary, what do you tell them they should eat? And what did you learn from doing that documentary?
Yes. So I learned quite a bit about nutrition by participating in the documentary because
Just tell the audience what the documentary was.
So there's a documentary called The Game Changers. It came out also in 2018 when my book came out, and they dovetailed very nicely, which was great. And it is on Netflix, and it is actually the most viewed documentary in the history of Netflix, believe it or not. Millions and millions and millions and millions of views. And it is about elite athletes who are vegan. That's what it's about. And it touches on all kinds of athletic performance aspects of diet, but it also looks at some other aspects of diet and performance, such as sexual performance. And that's where I came in. I was asked to give my expertise because I was known as a doctor in my community who promoted a plant-based diet before the movie came out. It turns out that the star and producer of the show, of the documentary, James Wilkes, he's a mixed martial arts champion who went plant-based after a severe injury when he was researching, well, how can I recover faster? He saw this as an option, pursued it, worked, then he went on to win, and decided to make a documentary. And I remember him showing up in my office years before the documentary came out with a handy cam and saying, hey, I'm James Wilkes, and he lives in my town, and I'm going to do this documentary. And my PCP, Dr. Sunshine, said that, you know a lot about plant-based, because I was asking him because I want to learn. And he said, I don't know anything about it. Go talk to Spitz. And I said, okay, great. And I didn't see him. And then a couple years later, he calls me back and he says, remember I was going to do this documentary? I'm like, oh, yeah. Yeah, he's like, yeah, James Cameron's the executive producer, and we're going to come and film you if you're still willing. I was like, okay. And 2 white vans filled with all this equipment show up in my office, and they've got Academy Award-winning directors and cinematographers and editors, and all of a sudden it was this big, big thing. And so they interviewed me in my office, and I did the, kind of like the normal interview. How does a plant-based diet affect your health, and male sexual function, and prostate cancer, and all this stuff? And it was a really good interview, and it was really nice. And then he said, all right, we're off. We're going around the world to interview other people. I said, well, when is this going to come out? I was like, probably not for like 2 years at least. So I didn't hear anything more. And then 2 years later, James shows back up, and he says, hey, Aaron, we just got done doing a scene with the Miami Dolphins where we gave 3 of the players different meals. One guy's vegan already, and the other guy got a fried chicken. The other guy got like a hamburger. And then they spun down their blood an hour after, and you could see the fat in the blood, which is the chyle. We know that we release chyle into the blood, but it was very visual. And the vegan player, his blood wasn't cloudy. And he said, James Cameron was wondering, is there like a single meal effect that we can show for sexual function that's like that, that's visual like that? And we think that would be really cool. And I said, no, there's not. Erectile dysfunction is a gradual disease over time, age-related, metabolic disease-related. There's not a single meal thing. And James is very intelligent, and he reads a lot, and he doesn't like to take no for an answer. And so he said, well, what about this Rigiscan? It's some way of measuring an erection. Can we measure an erection with a Rigiscan? And I said, well, first of all, I don't know where I'd find a Rigiscan because I haven't seen one of those in years. Nobody uses them anymore because everybody just prescribes Viagra. You don't have to figure out if it's in your head or not. And the way the Rigiscan works is it'll measure if you're getting erections while you're asleep and unconscious, and if you're getting full erections while you're unconscious. Then if you're not getting erections while you're conscious.
It didn't have 2 bands. It had a distal band and a proximal band.
Right. So 2 bands went on at the base of the shaft and the distal shaft. It would measure how much stretch was on it,
right,
how long that stretch lasted, And if it was a good stretch distally, just like proximally, and it would print out what looks like a seismograph for an earthquake. And so he goes, well, what about that? And I go, look, it's kind of a crude instrument. It's two wire rings surrounded by cloth, and there's gears that turn, and it kind of squeezes and lets go, and it measures what's happening, and it runs on 8 D-cell batteries. And the technology, if you can find it, hasn't changed, but it's a good instrument because it was used to validate the effectiveness of drugs for FDA approval, including Viagra and Cialis and all those. They did have a Rigiscan component. But I said, it's not going to show a single meal effect. It's going to show like a couple of years effect. And I said, I'm sorry. And he goes, well, what about like plasmography or duplex ultrasound? And I said, well, duplex ultrasound is so conditional on the anxiety level of the guy getting tested. You're not, and if there is an effect, it's going to be way too subtle and it's going to be confounded. And they're like, no, nothing's going to show this. I said, go talk to Irwin Goldstein. He knows more than I do. And so he did. He went and talked to Irwin Goldstein. And Irwin Goldstein was like, no. So then James came back to me, and I said, yeah, sorry, So flash forward, it's now August of 2017, and I'm on vacation in Miami Beach. And I'm just thinking about it. No, I'm sorry. Take that back. I got too far ahead of the story. This is good. So it's before that. It's around May of 2017, and the AUA in Boston is coming up. AUA Boston. And I said to James, look, we can try the Rigiscan thing, but I don't think it's going to work. But first, I got to find where they are and get some. And what we're going to do is we're going to do it on the youngest, healthiest legal men we can. Like they have to be over 18. But I need a tissue substrate that is as reactive as possible, right? An old guy's penis is not going to react to vegetables or meat, but a young guy's penis is as reactive as possible. So I said, get me 3 or 4 young, super healthy guys. We'll try it out. We'll see if it shows anything. So he ran a gym. So he got me 4 guys from his gym. I go to the AUA and I'm like, okay, who's the vendor for Rigiscan? And I look it up, and it's Tom Hopper. Tom Hopper. I had never met him before. He's got one of these booths that's like in the far recesses of the, it's
was it still for Rigiscan?
For Rigiscan. He is the Western Hemisphere rep for Rigiscan.
For the world.
For the Western Hemisphere. But he wasn't there to sell Rigiscans. He was there to sell those sleeves, the penile sleeves that you implant under the skin, the pneuma sleeve or something. Yeah.
Oh, pneuma.
Pneuma, yeah. That's what he was there to sell. So I find him like literally, in the shadows of the convention center where the booths are not very expensive, and he's a one-man army. And I go up to him and I go, do you want to be in a movie? And he goes, what? I said, and then I explained to him, well, there's this movie. We're doing this thing. I want to do the experiment. I do not want to buy Rigiscans. You'd have to provide them for free. But if this works, it'll put Rigiscan back on the map. And he's like, sure. And so he was able to round up 3. I'm like, he's the Western Hemispheric rep, and he had access to. No, these were refurbished.
Oh,
he gets me 3. Okay, so we get 3 guys. We come to my office. We hook them up. We show them how to use it, and we have them eat, a veggie burrito for dinner, and then they do the scan, and then we have them, eat a meat burrito for dinner, and they do the scan. Okay, so then they come back. The first guy, the thing malfunctions. It keeps squeezing and squeezing, and he rips it off. So that's no good. The second guy, the sensor or whatever malfunctions, so we don't have any good data. And then we have one guy with an N of 1. And I look at it and I don't see anything. And their statistician looks at it and they think maybe they see a signal. And I'm like, sorry. So now flash forward to Miami Beach in August. I'm laying there in my condo and I'm thinking, what if this actually could work? It would be pretty awesome. So I call, and James has told me that they're wrapping up shooting. They have to submit it to Sundance Film Festival the early next month, because the director, Luis Sahoyos, who is an Academy Award-winning director for The Cove, his Academy Award-winning feature premiered at Sundance, and they want him to premiere this at Sundance. And so there's 3 weeks before it's got to be in the can. So I call up James on a Wednesday, and I say, all right, James, if you're willing, I'm willing. You got to get me 3 really young, healthy guys. Meet me in my office on Monday. I'm in Florida. I'm coming back Sunday. Meet me Monday with a camera crew, and we'll do this. So he got me a baseball player from USC, who is now playing for the San Francisco Giants. He got me a basketball player from UC San Diego, and he got me a track and field hurdler from Cal Fullerton. These were perfect specimens, right? They're 19, 20, extremely fit, no drugs, no alcohol, right? This is exactly what we needed. And we equipped them with the Rigid scans.
The same Rigid scans.
Yeah, and I said, Tom, these have to be perfect condition. They cannot fail. This is one shot only. These have to be perfectly working. And he was there on site, making sure. And they went back to their dorms. They sent a camera crew to film them overnight with infrared. And so they all ate a meat burrito in my office, in my green room. And then they went off to sleep. And then they came back the next day and they ate a veggie burrito in my office, went to sleep. And now it's Wednesday and I'm doing a vasectomy reversal. All right. I get the printouts emailed to me and I'm looking at them and I'm like, oh my God, there's there's a big difference. 3 for 3. I mean, it's only 3. And I'm thinking, oh, this is crazy. I have to go on camera. I've got to say something about this. And whatever I say will be used against me, right? So I have to make sure that whatever I say is bulletproof. And I send it all to Irwin Goldstein because he has done a lot of Rigid scan work. He's published on it quite a bit. And he emailed me back in all caps, amazing. And congratulations. And I called him on the phone. I was like, all right, what do I say? And so we talked it through. And basically, there was a very clear signal there. You can't say it's a randomized controlled trial. You can't say it's more than it is, but there was a very clear signal. What was the signal? 2 to 3 times increase in erection after the veggie burrito compared to after the meat burrito. Both studies were normal. They were both normal, but one was a lot better than the other, 3 out of 3.
Did the guys know what you were trying to do?
No, they didn't know what the point of it was, except, we're going to do the scene with the food. And they didn't know the results until I revealed them to them. And that was a very fun and warm and touching kind of a moment because you've got these 3 guys, they're 19 years old, 20 years old, and they're about to be shown the results of their penises in front of each other. And so you have these 3 jocks who just melt down. They're embarrassed, they're giggling, they're nervous. And that really was one of the more popular scenes in the movie, it turned out, because of these guys, because it's just so honest. But it was really quite mind-blowing, what we were seeing on the graphs.
Yeah.
And James was right. You could do a single meal thing, and because he pushed, and I finally relented, and it made it into the movie, and it turned out to, like I said, be an important part of the movie. So important that when James Cameron gave a TED Talk about the movie, that was the scene he used.
Wow.
Yeah.
James Cameron is not the guy from Titanic.
Yeah.
Oh, the same.
Yeah, Titanic. The Abyss,
surprised he would do it.
Terminator.
Yeah.
Yeah. So his wife is a very strong proponent of plant-based diet, and Susie Cameron, and I think she may have influenced him to go plant-based. And so they're both proponents. And the other people that were in this movie that you'll know is Arnold Schwarzenegger. And they got Arnold to start to get on board, and he talks about that in the movie. I didn't get to meet him personally. And then just like this incredible array of elite athletes, Olympians, and ultra endurance people. So what I learned, both from the movie and before the movie, is that a plant-based diet has a lot of science behind it, demonstrating that it does improve circulatory health, which of course improves erectile health.
So are you on a plant-based diet?
Mostly. I'm about 90% plant-based. My friends wouldn't know it because I cheat when I travel and get together with people because I don't tend to, let's say, make people change what the meal's going to be, when I'm out socially and say, I have to have this kind of food because I'm not allergic to anything.
Right.
So
it's not peanuts.
I keep it easy. And so for me, that's sustainable. But, the more you can go towards a plant-based diet, I think the science really does bear out. Improve circulatory health, less cardiac disease. There's actually studies on erections themselves. And on that note, Robert Ostfeld is a vegan cardiologist at Maimonides, and he has the only inpatient vegan cardiology ward. He was approached to be in the Game Changers, and when he saw my scene, he reached out to me and said, let's do a clinical trial on this. And so between a donor that I had attached to the movie and a donor that he had attached to his vegan cardiology clinic, we have now completed 30 medical students on this movie scene. We're doing an actual clinical trial where they do one night, they do the Regiscan, and then they do 3 more meals, and they do it a second night. So it's a night and it's a day. And we finished our 30th out of 45.
And they're all in your geographic area?
These are all New York medical students.
So he does it.
So he does it. But, I help Erwin Goldstein, myself and him, design the study. Do
they all eat the same burritos?
And we also...
No, I'm serious.
So it's not exactly the same as the movie.
No, not in the movie, but I mean...
But it's a plant-based meal and then like a carnivore meal.
But is the carnivore meal the same amount of meat for all the students?
Yeah.
I'm talking like I'm reviewing.
Yeah, no, right.
the abstract.
Yes, and the hospital cafeteria and dietitians are charged with creating the meals.
Oh, that's good.
Yeah, and it's all, it's very robust.
So you've come back to your academic roots.
Exactly, yeah. So this is going to be a very interesting study, and I'm prepared if it doesn't show what we saw in the movie. That's okay, but it very well may. And so that launched the study. But there's also evidence that a plant-based diet decreases your risk of getting prostate cancer or of prostate cancer progressing and becoming more widespread. Studies have shown that men who are on active surveillance on a plant-based diet did not progress nearly as much as men who weren't, to needing their prostates removed. And men with metastatic cancer had a far slower progression of their disease on a plant-based diet. So I tell my patients to pursue a plant-based diet, and I tell them, the more you can move in that direction, the better. It doesn't have to be all or none, because I think with anything, you have to be able to sustain.
Right.
And if you can't sustain, then what good is it? And if your criteria is it's all or none, most people are going to fall off. Yeah.
I think it's a very important conversation we have to have with patients regarding prostate cancer. But I think the nutrition aspect oftentimes doesn't enter that conversation.
Absolutely.
But it could take 20 seconds. I mean, just simply saying, we know that a whole food, plant-based nutrition plan reduces risk of prostate cancer, improves your treatment after prostate cancer, and reduces recurrence risks. Do with that information what you will. Hear some examples of foods that are high in protein, because oftentimes people, if they're not intentional with their protein, won't be getting enough, especially on a plant-based diet.
Yep.
But one of my concerns with the plant-based movement is that there are a lot of foods out there that are plant-based that are very processed.
Yes. And that's why, like you said, whole food plant-based.
Yeah.
So what I tell my patients is go to the produce section and get most of your food there and eat it in that form, some raw, some cooked. And avoid the boxes and the wrappers, and keep it simple. And I say, eat as many different colors and textures of plants as you can, and you will likely get all of your nutrients and your protein. You don't have to have a complete protein in the same meal. You can get the different amino acids from your different meals over the course of a day or two, and it's fine. So I try to keep it very simple like that.
And what I like about the work that you're doing that started with the Game Changers is that every meal matters, and you don't have to be perfect, but maybe just making that next better decision. So you don't have to say, I'm going to go vegan for the rest of my life, but the next time I'm going to dinner later tonight, I'm going to make a better decision because it will directly impact me starting tonight. And I love that message. It makes it more manageable.
Yeah, that's right. Every meal is a new beginning. Your life, your life starts now, right?
Did you make that up?
I guess.
Every meal is a new beginning.
Yeah.
So
but it's true.
Yeah. And I love how you're making this education fun and accessible to people all around the world.
Well, I do enjoy teaching. Even though I didn't formally go into academics, I did take on a part-time academic position at UC Irvine for many years. And I actually even had an infertility fellow for 2 years.
Nice.
And the teaching component of it, grand rounds lectures and journal clubs, et cetera, was enjoyable. And so this is a way of teaching.
Yeah, I would like to finish out just closing with the musical.
Yes, let's get back to the
plans
musical.
for the musical.
Yes.
And also concerns that may not be appropriate for Broadway. So what have you heard from the people that you reach out to about this? What is the feedback?
So as far as the appropriateness of the material, is it too salacious? The feedback has been it's excellent. It's great. It does not cross any lines or push any buttons. It's rather the opposite. It speaks to people. It speaks to their heart. It speaks to their mind, and it's really been embraced by Broadway producers that have looked at it. We have a really great producer that we're working with, Evan Bernardin, and we just had one of the hot young directors review this script Michael Hurwitz. He's one of the 4 or 5 youngest Broadway directors in history. He just directed Jobs. 29-year-old young man looked at our script, really enjoyed it, really resonated with it, gave us some great feedback as well. So we're not concerned at all about the appropriateness of the content. Really where the challenge is, like with most things, is the money. So Broadway is very, very expensive. And off-Broadway is very, very expensive. But we are targeting an off-Broadway debut because of the economics of it, the likelihood of recouping investment. And off-Broadway is a very good launching pad to Broadway or to national tours, international tours. So it's, we think, our most cost-effective strategy. And it's also a very powerful artistic strategy. So right now what we're doing is we're developing the show. We have the script written. We have our producer. We're about to start interviewing directors. And then we will start to workshop it, meaning actually put it up on stage with the actors, with the costumes, with the choreography, all of that stuff. And typically what we want to do is what's called an out-of-town performance before we splash in New York, because you kind of get one shot in New York. The critics come out, and if you're not really ready, they're not going to come back a second time when you are. So we're working it out. I actually was offered by the Laguna Beach Playhouse where I live. They want it. They want it this summer, which was kind of unprecedented because usually you got to get in line about a year or two down the line because they've got their season filled, and they wanted to push stuff out of the way to bring this in, which was amazing. But they're not our only option. And so we'll do an out-of-town production in a regional theater. We may also show it at the Edinburgh Fringe Theatre Festival in Scotland, big international theatre festival that launches a lot of shows. And then once we've worked it out one or two times, we'll identify an off-Broadway theater. They'll want us because of our track record, and then we go for it.
So what's your timeline?
We're hoping to do regional presentation by this summer, whether it's Laguna Beach or whether it's Marist in New York or Poughkeepsie, what have you. And then if that goes well, be on stage in New York spring, summer, fall of 2027. Yeah. That's an ideal timeline. Things can take longer. These things can really, right, twist and turn. But we are very we are very optimistic that this is going to be successful. The producers that we've talked to really believe it has a tremendous commercial potential because of the nature of the material. It's a non-traditional audience it's bringing in. It's not the middle-aged women from Long Island. It's men and women from the whole country. And it's the kind of show that could play in many different venues, much like Menopause the Musical, which plays all over the world and addresses, women's health issues, or Vagina Monologues, which is a different kind of a show, but you get the idea.
Right.
And so we're very optimistic, but we are fundraising right now, and we are inviting investors in this developmental phase, and we've had several doctors
out there watching who may be very interested.
But yeah, so that's the timeline.
That's great.
Yeah, it's very exciting. It's very fun, and being able to get into recording studios and theaters and work with these incredibly talented performers is just so much fun. These singers and musicians, they're no less professionals than we surgeons, and they pick up a script, they pick up music, and in a very short timeline they've mastered it, and it's remarkable. But they are professionals at the top of their game, and it's been really fun to look at this whole other world in that way.
Yeah.
I love it.
Well, we enjoyed you coming here and sharing your
it's been a pleasure
work with you and your
I think
future.
I could talk to you for hours.
We're very excited about getting those opening night tickets.
Yes.
Don't forget the little people once you go big.
Right.
It just takes a share.
Just remember where you started.
Yes, I'll never forget. No.
Okay, thank you again.
It's really been my pleasure, and also it's always an honor to be invited to do anything with you, Larry. I appreciate it. And Amy, what a pleasure to meet you in person. Finally, I've followed your content for a long time, and you're incredibly dynamic. And we're talking about education. You've done an incredible amount to educate people on the same topic. So, congratulations to you, and thank you for inviting me.
All right.
Yeah.
Thank you.
Larry, it was so great to meet with Aaron Spitz today. He is a urologic figure and media figure that I have been watching from the outside for so many years. I initially got introduced to him through his book, The Penis Book, and I read it. I remember I was in the state of Iowa. I was on the Stairmaster reading his book. And part of our conversation with him was talking about who is the audience for this book. And honestly, it's everyone. It's a person who owns a penis or anyone who cares about someone with a penis. And for me, it gives me language to educate men in my office on complex men's health issues in a way that someone can understand who doesn't have all this medical knowledge.
Right. So do you share the book with them, or do you just give them like excerpts?
So I've given people, the book before as a resource, but that's like a really good point, because what he does in his office is he doesn't give people the book, but he'll share chapters with them.
Yeah,
and I think I need to do that too.
Probably has them copied. And, yeah.
But I think I should, instead of just saying to someone, hey, why don't you read this entire book? Because sometimes that can be overwhelming and they might not have time to do that. But I should direct them to a specific chapter.
Yeah, I think that's a great idea. I'm going to start doing that.
Yeah. Oftentimes in medicine, we think all the education we need to give our patients has to be done in however long that visit is. And the reality is that the purpose of that visit is for chatting. And then our exit strategy has to be, this is what you're going to do at home. So much of the education and learning can be done at home. So I think it's a wonderful resource.
Yeah. And I also thoroughly enjoyed hearing excerpts from his musical.
It made me a little sad.
Yeah, it was a
that
sad
one song. Yeah,
I got a little choked up.
I know, I did.
But I think the fascinating thing is not only is Aaron smart and a great urologist, but this is creative genius.
Yeah.
I mean, to come up with this topic and make it palatable and something that may even end up, and I really think it will, on Broadway or off Broadway.
Yeah.
And it's so exciting to have been in on this early part of it. So I thought it was really, really a fascinating meeting.
When he makes it big, do you think he'll remember us little people that we interviewed him early on?
Yes, knowing Aaron, he will never forget his old friends.
The last thing that I want to mention is in discussion of nutrition and his role on the Game Changers. What I found fascinating, and certainly, the number of people that they had in his study using the Ridges scan was a very small number. It was a couple of patients, but he's currently working on, he finished enrolling patients in a trial looking at nutrition.
I think he said there were 30.
Yeah. And sexual health. And what's fascinating is this notion that a single meal can impact erectile function in real time.
Do you believe that?
I do believe it. And I'll tell you why I believe it, Larry, because if we can drink alcohol in a single night and notice direct impact on erectile function later that night, why wouldn't food have a direct impact on our bodies that night? If we can take a little pill, and that can make things better or worse, why wouldn't a full plate of food have that same immediate impact? And I think there's power in that. There's power to say, Larry, you don't have to eat perfectly for the rest of your life to have optimal erectile function. What you do need to do is make that next better decision. And I think that's literally more palatable.
Yeah, I agree. I mean, it's very interesting. I'm a little, dubious about exactly what's going on, because I don't think the alcohol is a good analogy, because what the alcohol doing is like numbing everything. It's turning off things. And you can turn off things a lot faster than you can turn them on, I think, because to turn them on requires some physiologic changes. And so, I'm very excited to see the results of this larger study. And like you say, it's important.
Yeah. Well, I'm going to eat more veggies.
You are what you eat.
You are what you eat. That is certainly right. And I'm going to eat more vegetables, because it turns out...
But you don't have erection problems.
I don't have erection problems, but I do have erectile tissue just as much as any other man around.
I don't even want to go there.
Yeah. So whatever the advice we give to men is in terms of optimizing their erectile function, honestly, it also pertains to the ladies.
We'll have to get into that at a separate episode.
Oh, we certainly will. You betcha.
Yeah. So I think the final F word for today would have to be funny.
All right, Larry, why don't you give us some foreplay for the next episode?
Okay, so foreplay. For the next episode, we're going to focus on the diagnosis and treatment, especially the treatment of erectile dysfunction. And we'll go into all the different entities that are available for men.
Yeah, and I'm going to share some of the innovative technology that are not yet currently available, but set to come out in 2026 that people want to know about starting sooner than that.
Oh, that's exciting.
Yeah.
So I look forward to hearing what you have to say.
Thank you for joining us today on Fertility and Other F Words.
And please don't forget to like, subscribe, and leave a comment.
Until next time.
When you gotta go every hour or so, and the urge is strong, but there's something wrong, 'cause you start the story at the urinal, and you're pushing strain, but it barely drains.
Some like it hot, and some like it rough. I
didn't mind.
Come on, honey, she was trying to be kind.
We met in the hectic hallways of the county hospital. A freshly minted intern, you would take life by the balls. And I wanted to come with you, and you said it must be fate. And the days were long and lonely, but the nights were worth the wait.